Good day. I myself, Dr. Deepak, third year postgraduate from SDMC Medical College from Kolar, from Department of General Medicine, hereby presenting a paper regarding renal complications in COVID-19 patients in a tertiary setup in a Kolar. Coming to the introduction, as we all know, live in a pandemic era where WHO has declared COVID-19 as a pandemic, global pandemic from March 2020. The first case of COVID-19, as we all know, India, which was originated from China, was reported on Jan 30, 2020. India currently has the largest number of confirmed cases in Asia and has the second number of cases in the world right after United States. As well, coming to our topic, acute kidney injury (AKI) has been reported in up to 25% of the critically ill patients in COVID infection, especially in those with underlying comorbidities. AKI is associated with high mortality and even morbidity, with increases the number of hospital stay and the oxygen support, especially when renal replacement therapy is required. This pathophysiology of COVID-19 has two mechanisms. As we all know, so unrelated, unspecific mechanism, which may be due to pre-renal, as in patient might have developed a septic shock, or due to the patient might have developed any thromboembolic complications, which will lead to AKI. And also it can have a direct cellular injury. As postulated, this COVID virus enters the cell through the ACE2 receptors, and we all know this ACE2 receptors, angiotensin converting enzyme 2 receptors, is highly expressed in kidney. So there might be the direct cellular injury possibility also is there, and which can cause an imbalanced renin angiotensin aldosterone system. Apart from that, there can be pro-inflammatory cytokines elicited by this viral infection and thrombotic events. The aim and objective of the study is to look for the prevalence and renal complications like acute kidney injury in COVID-19 positive patients and its effect on their mortality and morbidity. This is a retrospective observational study. The sample size was calculated using the EPS operator and found to be 290, or sample size of 290, which is a retrospective observation study. The patients coming to SDMC Medical College with fever, cough, breathlessness, and with COVID RT-PCR positive were taken in. Total of 290 patients were taken, and careful history was recorded, and general physical and systemic examinations were performed. Renal function test will be collected, and difference in the mortality and morbidity in patients who develop renal complications will be compared. In about 290 patients, about 25% of the patients developed AK, and 75%, 25% in our hospital setup developed AK. And we are discussing about this 290 patients and their AK and their mortality and morbidity. The patients who developed AK as mostly were prevalent, 30% only were female and 70% were found to be male. But in our study, also the 30% were only female and 70% were found to be male. Coming to the patients, this 25% of the patients who developed AKI, in this more patients were found to be around the age group of 41 to 50 years. The least common being the more than 70 years and 21 to 30 years. And coming to the comorbidity, the patients distribution of the patients in developing AKI according to the comorbidity taken into accounts were diabetes, hypertension, coronary artery disease, hypothyroid, and bronchial asthma patients also were included. Among the 161 patients who had comorbidity, 44 patients developed about AKI. That is, among 100% of the patients with comorbidity, 27.3% of patients developed AKI, and 117 patients developed AKI with patients without any comorbidities. As we know, coming to general specifications, about 16 females developed AKI for a total of 88. and 49 male patients developed AK of total of 202 patients. So as we all know, totally 22.4% patient of the patient developed AK, which is about 65% patients in total of 290. Coming to the patients who develop AK, they're based in creat. The baseline WBC, LDH, and ferritin inflammatory markers were taken into account. In patient developing AK, the mean WBC was found to be 15,000 compared to 12,000 of the patients who didn't develop AK, but it was statistically were not significant. And LDH was found to be baseline LDH was found to be 600 in patient develop AK, and 456 in patient who didn't develop an AK. And ferritin was found to be around 560 in patients who developed AK, and mean ferritin was found to be around only 380 in patients who didn't develop AK. And this ferritin among the WBC and inflammatory markers, only ferritin was found to be statistically significant for patient developing with AK. Duration of stay. Among the 22.4% of patients who developed AK, the duration of stay is about 11 days. Patients who were discharged. But the patient who was not developed AK, the duration of stay was found to be only 10 days. But it was not. Coming to the course of treatment in the hospital of patients who develop and AK and without AK, among the 1 or 2 patients who required face mask, about 12.7% were found to be AK and 87.3% found to be without AK. But the patients who developed only as we all know, only 65 patients who developed AK.
Time
in
up.
that 65, hello.
Please conclude.
Okay. Among the 65 patients who developed AK, 27 patients are found to be on mechanical ventilator, and 8 patients had NIV, and only 5 patients had room air. And among the 72 deaths occurred in the about 290 patients, only 41 patients were found to be AK, and 31 patients found to be without AK. So it had a statistically significant impact. The AK had a statistically significant impact on death. So coming to the observation, among 290 subjects, 65 patients, that is 22.4%, were found to have AK, in which majority were male patients and belonging to 41 to 50 years of age group. It was also noted that out of the total 72 deaths in 290 patients, 56.9% were found to have AK, that is 41 patients, and patients with AK had showed statistically significant difference in the duration of hospital stay also. As you all know, up to date, there is no specific treatment for AK-induced AK, COVID-induced AK. A number of investigational agents are being explored for antiviral and inflammatory immunomodulatory treatment. On AK is still unknown. This indications, timing, and modalities of renal replacement therapy currently rely on non-specific data and focusing on patients with sepsis. And currently, there are no specific data to regarding the treatment and management of the AK. So still, it has to be explored. So this study focuses on incidence and its incidence of AK and the risk of AK in those patients affecting the mortality and morbidity, and aims to investigate the effects of COVID infection on renal function and patients with COVID-19. These are the references for this presentation. Thank you.